Hello dear students, today we will discuss a topic which is not uncommon, rather often distressing. That is where near the anal canal it happens, part of the anorectal disease. That is, just see what this condition is. Look at that, scrotum is here, anal canal is here. You can see the slough is there. You can see some sort of swelling here, probably on palpation you may get induration also. Related with the ulcer, very typical. So must be carcinoma at the anal canal or anal margin tumor. So it is anal margin tumor, squamous cell carcinoma. Anal canal is above the dentate line, anal margin is below the dentate line. Remember, anal canal above, anal margin is below the dentate line. And it is raised and everted with the necrotic area. It will be indurated, hard, tender, and maybe fixed. Is that hard induration is the typical. Everted edge is very typical for carcinoma. Invariably, it is squamous cell carcinoma. And both sides inguinal lymph nodes, mainly drains to the inguinal lymph nodes, maybe palpable as hard nodes, often palpable external iliac nodes are there. Ulceration, pain, palpable inguinal lymph nodes, distressing area, passing motion is difficult. Sometimes it goes narrow so much, you may go for a subacute obstruction also. Rectal examination often a difficult test, which is a must. In such situation, when the pain is there, tenderness is there, do examination under general anesthesia or final anesthesia. Usually general anesthesia for short time is required. Examination under anesthesia is very, very important because it will give a rather more clue of extent, induration, proximal extent, how far is extending beyond. So probably possible provisional staging, not exactly final staging, but at least clinically you can have the idea about the staging, local staging. And SCC is the commonest one, basaloid, BCC, melanoma, adenocarcinoma can occur. Wedge biopsy from the edge, MRI of the part, CCT abdomen and pelvis is needed. HIV, human papilloma virus is very commonly known, like in oral malignancy. Here also human papilloma, genital malignancy, human papilloma virus is common. So you have to always do a molecular study of that. HIV you have to do. HIV is very common in this patient. And previous long-standing fistula in may turn into squamous cell because another thing. Past history of fistula surgery, long-standing fistula, not 2-3 years, more than 10-15 years fistula, persisting active fistula may turn into squamous cell, not every fistula, when into squamous cell carcinoma. So that's the point you have to remember. Management is, AJCC staging you have to remember, you can always go through my manual. Chemo radiotherapy is a treatment initially, then of course after that, abdominoperal resection. You remove the anal canal, you can't retain the anal canal in this patient. Anal canal, proximal rectum, then do a permanent end colostomy, maybe in the left side because growth is rather distal. Sigmoid end colostomy can do as a permanent one. And then came the Negro regime, remember it's an MCQ question. Negro, Norman Negro in 1970s, he has invented, he started this one regime. So initial RT, radiotherapy for 3 weeks, then chemotherapy, 5-fluorouracil, mitomycin C, then abdominal peritoneal resection, radiotherapy, chemotherapy, then surgery, APR, abdominoperitoneal resection. Neoadjuvant chemotherapy, 5FU, mitomycin C, cisplatin can be used. The different modalities, neoadjuvant, surgery, adjuvant, RT, chemotherapy, APR. That is the Negro regime actually. So these are the different things you have to always remember, not uncommon entity. When you do a rectal examination, C rectum, C anal canal has to be kept off in all patients with the anal canal symptoms like discharge, pain, mass, bleeding. So every bleeding per annum, per rectum is not piles, or every discharge is not fistula, because keep in mind rectal malignancy, anal canal malignancy, if you miss, it's dead. It's a mortality very high. You may lose the patient. So rectal examination clinical is very, very important in all these patients. So consider these things and rule out these things and say this is piles, fistula, fissure, and so on. To answer the MCQ, the common cause of anal stenosis is anal neoplasia, Crohn's disease, radiation, iatrogenic. Answer another MCQ, human papilloma virus commonly involved in anal intraepithelial neoplasia and anal cancer are HPV 6 and 7, HPV 8 and 11, HPV 11 and 13, HPV 16 and 19. Students answer the right, give the right answer, and I will get back to you in a later dish. So please answer all the both MCQs. Students, I hope you understood this anal margin tumor, anal malignancies, which is not uncommon. So thank you so much. Students, so please go through my SRB's clinical methods in surgery, current edition. It gives a video like the examination of the different clinical situations. It gives a detailed examination method including history taking of swelling, ulcer, hernia, inguinal swelling, mass abdomen, breast lump, thyroid, neck swelling, salivary glands, all topics, including briefly trauma, how to approach orthopedic briefly. Then it also includes the instruments, specimens, images, briefly operative surgery, entire thing, clinical method with a lot of photos, illustrations, each condition's photos are there, it's very clear. And analysis, history taking, detail, examination, general examination, history taking, history of present illness and past history, current history, treatment history, drug history, local examination, inspection, palpation, percussion, auscultation, clinical diagnosis, differential diagnosis, and briefly in a table form, all differential diagnosis. But it doesn't contain treatment aspect because clinical surgery book only for clinical surgery, analysis and differential diagnosis. So treatment should be checked in detail, principles of treatment should be checked in the manual, my SRB manual of surgery. So this is basically clinical book with the videos of each examination with all illustrations, principles, different methods, different techniques, science. My service manual of surgery current edition gives a CBM syllabus, entirely covers all topics, general surgery, endocrine, surgery, thyroid, breast, GI surgery, urology, cardiothoracic, neurosurgery, then other topics, arteries, disease, veins, its principles, methods, clinical methods, treatment, complications, approaches, with the quotations in the each page. It covers entire thing, including treatment principles, brief operative procedure also, not in detail. And it also covers briefly instruments, images, anesthesia, briefly oncological aspect, and daycare surgery, audit, surgical audit, metabolic response to surgery, pain management, everything covers as far as required for the CBM syllabus for UGs, PGs and consultant, coming consultant also, with the illustrations, photos, a few video lectures and a lot of MCQs online for each chapter with the QR code. Lot of MCQs for each topic, so each chapter it is there. Covers everything for UGs, PGs, CBM, MCQs, NEET exam, whatever required thing. Please go through it. Very, very useful book. My operative surgery, extensive voluminous book, 2-volume book, mainly for postgraduates and learning surgeons. All procedures, including major surgery, GI surgery, general surgery, thyroid, breast and other things, include briefly gynecology surgeries, with step-by-step illustration photos, more than 10,000 photos and illustrations are, and which covers everything for to learner. You can, before surgery, they can go through my book and have a step-by-step for the all surgeries, whatever common surgeries, major surgeries, it is there. You can always go through that. In detail, explanations are there. My small atlas of tissue approximation with the videos shows clearly, with the principles, how to suture tissues, dissection and tissue approximation. There are two parts in surgery. Dissection is a principle, essential. After dissection surgery, you have to approximate tissues, deeper layer, skin, softer tissues, everything, bowel, GI, everything. So this principle of tissue approximation clearly given in this book with the videos of it, including laparoscopic tissue approximation. So you can always purchase that and go through that. Very, very useful thing for to develop the skin, which is essential for all surgeons. Students, I also request all of you subscribe my website, both in YouTube, Instagram and so on. My DigiNow lectures to the JP publisher covers around 220 lectures in detail as far as CBME syllabus, from general surgery to specialty, urology, clinical examination, cardiothoracic, neurosurgery, all topics, GI, rectum, anal canal, colon, esophagus, liver, pancreas, breast, thyroid, neck, salivary gland, general surgery, artery, vein, everything in detail, all topics, theoretical aspect, surgical principle, operative surgeries, the examination, clinical examination videos also. It covers 220 lectures, covers everything. 1 year purchase you can do. It gives detailed thing about explanations with wherever MCQs are required. You can make use of it and you can learn surgery properly as far as CBM syllabus and academic wise also. It gives lot of information towards the surgical field as such. So students, I hope you have understood this lecture very well, and also you can go through my books, all these books, with including DigiNow and lectures. Thank you very much.